Good morning. I'm Dr. Marianne Gale from New South Wales Health with the COVID-19 update for today, Thursday, the 21st of October. In the 24 hours till 8 p.m. last night in New South Wales, there were 372 locally acquired cases of COVID-19 reported, and there were also more than 86,000 COVID-19 tests also reported in that period. Across New South Wales, 92.5% of people aged 16 years and over had received a first dose of a COVID-19 vaccine, and 82.3% were fully vaccinated. In the 12 to 15 year age group, 76.1% have had their first dose, and 40.9% are fully vaccinated. So really great achievements across all those age groups, and a big thank you to everybody who's come forward for vaccination. And a big thank you to all our GPs, pharmacists, and people in New South Wales health clinics delivering vaccination for a continued huge effort. Currently in hospital, there are 523 COVID-19 cases admitted and 124 people in intensive care, 64 of whom require ventilation. Of the 124 people in ICU, 96 people are not vaccinated, 17 people had received a first dose of a COVID-19 vaccine, and 11 people had received 2 doses of a COVID-19 vaccine. Today, I'm sad to report the death of one gentleman in his 50s from southeastern Sydney who died at Sutherland Hospital. He had received 1 dose of a COVID-19 vaccine. I extend my sincere condolences on behalf of New South Wales Health to the family and friends of that gentleman. Since the 16th of June, there have been 487 COVID-19 related deaths in New South Wales and 543 since the start of the pandemic. Our ongoing sewage surveillance program has detected fragments of the virus in sewage samples collected in the following areas where we are not currently aware of cases, and they are Lightning Ridge, Armidale, Uralla, Inverell and Nyngan. So if you live or know someone who lives in those areas, it's really important to get tested if you have even the mildest of symptoms. So please be vigilant and get tested if you feel even a little bit unwell. So as we come to the end of the first week of school returning, and we look forward to welcoming even more students into the classroom next week, I'd like to particularly stress today the importance of vaccination of young people aged 12 to 15. So far, more than 76% of our 12 to 15-year-olds in New South Wales have had a first dose. So a really great effort, and a big thank you to all those young people and their families. And I want us across the state to do even better. And this Saturday and Sunday, New South Wales Health is running a special walk-in weekend for young people aged 12 to 15 years. So please, if you or someone in your life is in that age group of 12 to 15 years and not yet vaccinated or not yet received a second dose, now is the chance. There are going to be 40 vaccination locations across New South Wales where young people can walk in with their parent or guardian to get their vaccination. It will be free and no appointment is necessary. I'd like to particularly call on young people in southwestern Sydney and across the Hunter region to come forward for vaccination. And there are walk-in clinics in Cessnock, Newcastle, as well as Bankstown, Liverpool and Macquarie Fields. The nearest vaccination location for you can be found on the website of newsouthwales.gov.au. So please, I'd encourage you all to take advantage of that opportunity across New South Wales this weekend, and please check the website for your nearest vaccination clinic location. Finally, I'd like to particularly encourage people in the Hunter region and people who live in the area of Albury to come forward for testing if you have even the mildest of symptoms. We are seeing increased case numbers in those areas in particular, so we ask you to please be vigilant if you live in those areas. So again, thank you very much for your continued efforts to get vaccinated, to get tested, and for continuing to help limit the spread of COVID-19 in New South Wales. So thank you, and please stay safe.